Welcome dear participants, welcome to the SWAYAM course. This is the week 6 lecture number 4 and module is endocrine system. So already in this module we have discussed in the last two classes that what is called as a hormone and then what are the receptors are there, and after that we have discussed about the hormones of the hypothalamus, anterior this pituitary gland and the thyroid gland. So up to the function of the thyroid hormone we have discussed. So in this class we have discussed about the what are the abnormalities are there, abnormal secretion of the thyroid gland, and then we'll see what are the hormones secreted from the parathyroid gland, and then we'll see what are the hormones that is secreted from the adrenal gland, what are their abnormalities. And adrenal gland means we'll see the hormones which are secreted from the adrenal cortex and hormone which are secreted from the adrenal medulla. So all these things we will discuss in this particular class. So let's continue with the where the previous class ended. In the previous class we have ended at the what are the functions of the thyroid hormone. So here we will discuss what are the abnormal secretion of the thyroid hormone, means if hypothyroidism is there or hyperthyroidism is there, what are the diseases there that occurs due to the hypo or the hyper secretion of the thyroid gland. So first we will discuss the hypothyroidism. So hypothyroidism is causes the general reduction in the metabolic rate that is characterized by the slow heart rate, decreased body temperature that causes the infertility, weight gain and slower mental ability. So why all these things happen? Because in the function of the thyroid hormone we have discussed that thyroid gland is required for the development of nerve cells. So if the deficiency will be there, then naturally the mental ability will takes place. And I told that this thyroid gland help in the maintenance of the basal metabolic rate. So if thyroid deficiency will be there, then naturally the metabolic rate will be reduced. So one important disease is there related to hypothyroidism, that is called as a goiter. Goiter is a quite natural in the initial years of that one, that development of swelling of this thyroid gland is taking place. So why this goiter is taking place? Because of the deficiency of the iodine mainly. Because in the synthesis of thyroid hormone I told that iodine is required for the means formation of the T3 and T4 hormones. So if the deficiency of iodine is there, then the formation of that is not taking place. So what is happening here? In case of the goiter, the iodine deficiency causes the enlargement of the thyroid gland. That condition is called as a goiter. So due to deficiency of iodine, why enlargement is taking place? Why enlargement of thyroid gland is taking place? The reason for this is that since the T3 and T4 are not produced, I told that for the production of T3 and T4 iodine is necessary, and here means iodine is not available. So T3 and T4 formation will not take place, and because T3 and T4 are not producing, there is no negative feedback on the hypothalamic production of the TRH, thyrotropin releasing hormone. So since T3 and T4 is responsible for providing the negative feedback, and here since the production of T3 and T4 is not there, so there is no negative feedback on the TRH. So continuous production of TRH is taking place, and that TRH will continuously stimulate the increased production of thyroglobulin inside the colloidal. So due to this continuous production of thyroglobulin, the thyroid follicle will enlarge, and because of this enlargement of the thyroid follicle, the thyroid gland are getting enlarged. So that's the main reason why in case of the iodine deficiency, that enlargement of the thyroid gland is taking place, that take place in the goiter. Second deficiency disease called as autoimmune thyroiditis. That is the most common cause of hypothyroidism in case of the dog. So this is basically autoimmune conditions where the dog immune system will attack the normal follicular tissue, and then what will be the symptoms will be there will be the weight gain and the thinning of the hair coat with the alopecia. So these are the common symptoms which is occurring in the autoimmune thyroiditis. Then third is called as a myxedema. Myxedema develops in adults with total lack of the thyroid hormone functions. So if the total inhibition of the production of the thyroid gland hormone will takes place, then that myxedema like condition will takes place. What is symptom here? Then bagginess under the eye and the swelling of the face will takes place. So below the eye there is a bagginess, means like things will takes place. That is a important symptoms of the mixed edema. Then fourth one is called as a cretinism. Cretinism is caused by the extreme hypothyroidism during the fetal life, infancy or the childhood. So here the difference I told when we are discussing about this dwarfism, at that time I told that there is a difference between the cretinism and the dwarfism. In the dwarfism there is I told that there is a proportionate growth, although the hormone means development will be less, but proportionate body growth will take place. But here in case of the cretinism, if the deficiency of the thyroid hormone takes place during the childhood stage, the development of cretinism will take place, and here the disproportionate growth of the body tissue will takes place. Also there will be the less body growth, and also there will be the mental retardation. So these are the important symptoms of the cretinism. Then another one that is called as a hyperthyroidism, is the excessive secretion of thyroid gland hormone will takes place. Then that lead to the increased heart rate, polyphagia, intolerance to the heat, increased sweating, extreme fatigue but inability to sleep. Person will be extremely fatigued but they will not get the sleep, and then also there will be the weight loss. So these are the important symptoms of the hyperthyroidism. Important disease related to hyperthyroidism is called as a Graves' disease. This occurs due to excessive secretion of the thyroid hormone, and how it is occurring, it occurs due to very strange antibody formation is take place by the lymphocyte, and that comes into the bloodstream. And what they will do, this antibody will mimic the TSH, thyroid stimulating hormone, and will bind to the TSH receptor on the thyroid follicle and will initiate the thyroid hormone secretion. So it will mimic the TSH and will bind to the TSH receptor, and that's why the continuous production of the thyroid hormone will takes place. So what are the important symptoms in the Graves' disease? That there will be the protrusion of the eyeballs and the exophthalmos will takes place. The eyeball will be come out. So that is the important symptoms of the Graves' disease. Then another important hormone is there, that is called as a calcitonin. Calcitonin is secreted from the parafollicular or C cells. That when we are discussing about the thyroid gland, at that time I told that very important cells are there in between the follicles, that is called as a parafollicular cells, and these cells will secrete the important hormone that is called as a calcitonin. So when calcitonin will be secreted when the blood calcium level will be high in the body. So what is the role of calcitonin? Calcitonin will decrease the plasma calcium concentration and has effect opposite to that of the parathormone. So what calcitonin will do? Calcitonin will reduce the blood calcium level. If blood calcium level will high in the blood, the calcitonin will reduce the blood calcium level, and its effect is just opposite to the parathormone, that we will see later. So how this calcitonin do this lowering of the blood calcium level? One is that this calcitonin bind receptor to the renal tubules and inhibit the renal tubular reabsorption of calcium. So naturally if the absorption will be less, then naturally the blood more calcium will be go out of the body and the calcium level will be lowered. Second is that calcium binds to receptor on the osteoclast cell and inhibit the bone reabsorption activity of the osteoclast, and thereby reducing the liberation of calcium and phosphate from the bone. So in this way it will also reduce the blood calcium level, and also calcitonin increase the excretion of phosphate through the urine by inhibiting the reabsorption from the renal tubule. So they will also reduce the phosphate level. So calcitonin have main role in lowering the blood calcium level. So that is about the thyroid gland. Next gland is the parathyroid gland. So parathyroid gland located in the cranial and the caudal portion of the each thyroid lobe, and this parathyroid gland have two important type of cell. One is called as the chief cells, that is active cells, that is called as the chief cells, and another is inactive or degenerate cells, that is called as a oxyphil cells. So this chief cells is mainly responsible for the production of important hormone from the parathyroid gland, that is called as a parathormone. So parathormone is the hormone which is secreted from the parathyroid gland, and the cells responsible for that is the chief cells. So what is the important function of the parathormone is that it help involve in the control of the calcium and the phosphate metabolism. So synthesis of parathormone hormone is very similar to the other protein hormone that already we have seen. So parathormone action is just opposite to that of the calcitonin. Calcitonin, we have seen that calcitonin help in reducing the blood calcium level, whereas the parathormone will increase the blood calcium level. If blood calcium level is low in the blood, the parathormone hormone will be secreted to enhance the blood calcium level. The effect of parathormone is to increase the calcium and decrease the phosphate concentration in the extracellular fluid. So, how it will do? Parathormone have direct action on the bone and the kidney metabolism of the calcium, and it have an indirect effect on the gastrointestinal metabolism of the calcium. So, parathormone act directly on the bone and the kidney to help in the increase in the blood calcium level, whereas parathormone has indirect effect on the gastrointestinal tract, where indirectly they will act on the GI tract to enhance the blood calcium level. Parathormone increase the osteoclastic activity and inhibition of the osteoblastic activity that result in the release of both calcium and phosphate. And this parathormone increase the calcium absorption and decrease the renal phosphate reabsorption. So, if the calcium reabsorption will be increased, naturally the more calcium will come into the blood. So, in this way the parathormone help in the increase in the blood calcium level. Now, what will be happen if there will be the abnormal secretion of parathyroid hormone will takes place? So, two important condition is there. One is called as a hypoparathyroidism, another is called as a hyperparathyroidism. So, hypoparathyroidism means if there is a less secretion of the parathyroid hormone. So, if there is a decrease or insufficient secretion of parathormone, so in this case what will happen? The calcium level in the blood will fall from the normal and the blood phosphate concentration may be increased to double, because we know that this parathormone help in the increase in the level of the blood calcium level. So, if parathormone deficiency will be there, then what will happen? The blood calcium level will be lower, and when this calcium will be reached to low level, that will give the sign of the development of tetany. So, that muscular spasm will takes place if this condition will develop. Another is called as a hyperparathyroidism. Hyperparathyroidism means if there be excess secretion of the parathormone, and that may occurs due to the tumor in one of the parathyroid gland, and here the hyperparathyroidism will cause the extreme osteoclastic activity in the bones, and here the blood calcium level will be very high in the extracellular fluid because of the tumor formation in the one of the parathyroid gland. So, that how the abnormal secretion is there. One is the hypoparathyroidism, another is the hyperparathyroidism. Now, how the calcium control is taking place by the hormones. So, what are the hormones are required for the regulation of the calcium in the body? So, calcium homeostasis. So, how the calcium concentration is maintained in the extracellular as well as the intracellular fluid. So, this calcium homeostasis is maintained by three important hormone. One is called as a parathormone, that is secreted from the parathyroid gland. Second is called as the calcitriol, or its chemical name is 1,25-dihydroxycalciferol, that comes from the kidney tubules. And third is called as a calcitonin, that is secreted from the thyroid gland's C cells. So, these three hormones, parathormone, calcitriol and calcitonin, these three hormones help in the regulation of calcium concentration in the intracellular as well as the extracellular fluid. So, this parathormone and calcitriol will stimulate the release of calcium from the bone, while the calcitonin will prevent the release of the calcium from the bone. So, parathormone and calcitriol will enhance or increase the blood calcium level, whereas this calcitonin will reduce the blood calcium level. So, in this way, whatever the increase is there, that will be decreased, and whatever the decreased concentration there, that may be enhanced. So, these three hormones will help in the regulation of blood calcium level. So, one special condition is there called as a special calcium homeostasis. So, as we know that without this vitamin D3, that is 1,25-dihydroxycholecalciferol, most of the animals are unable to acquire the enough calcium from the diet to support the normal bone structure, because 1,25-dihydroxycholecalciferol is the hormone which help in the indirect reabsorption of calcium from the GI tract. So, most of the animals utilizing this mechanism to maintain their calcium level in the blood. But an exception is there, that exception is mainly the horse and the rabbit. That is, horse and rabbit are the hindgut fermenters. So, in these species what is happening, the calcium available for reabsorption is absorbed through the diet independent of the vitamin D. So, previously we have seen that vitamin D or 125 dihydroxycholecalciferol help in the absorption of calcium from the GI tract. But in these two species, this calcium regulation is independent of the vitamin D. So what they will do, they regulate the blood calcium by increasing or decreasing the urinary calcium loss. So through the urinary, if the more concentration will be there, it will be come out through the urine, and if it will less concentration, then will be there, it will be reabsorbed through the renal tubule. So they will regulate the blood calcium by increasing or decreasing the urinary calcium loss. So they excrete an dietary calcium that is not needed. That's why these species often have a chalky white color urine. So because of the urinary excretion of the calcium, these species, especially the horse and the rabbit, have the chalky white color urine, because if excessive amount of calcium is present, that will be get out of through the urine. Now, what are the disease which is related to the calcium and the phosphate metabolism? So, one important disease is called as a rickets, that occurs due to deficiency of the vitamin D, and this results from the calcium and phosphate deficiency in the extracellular fluid, usually caused by the lack of the vitamin D. And here what is happening, the dietary calcium in the young animals lead to failure to mineralize new bone and contribute to the retarded growth. So due to deficiency of vitamin D, what is happening here, the bones mineralization will not takes place, and if the bone mineralization will not takes place, the growth will not be proper. So that's why the animals have the retarded growth. So here important symptoms are there. They will have the rachitic rosary, then they will have the pigeon chest. The chest will not expand in a normal way, they have a pigeon chest, and then also they have a unusual curving of the spines will not be in a proper shape, they will be the unusual curving of the spines. So all these things happening due to deficiency of the vitamin D. So that is called as a rickets. Another disease called as a osteomalacia, it also called as a adult rickets, that occurs in an older animal due to deficiency of the vitamin D. This causes the osteoporosis and the osteomalacia and the bones, which makes the bone prone to the spontaneous fracture. So this type of condition is occurring in the adult animal due to deficiency of vitamin D, and this causes the osteoporosis or the osteomalacia, and this type of bones are very prone to the fracture. So that is called as a osteomalacia. Next is called as a lactational osteoporosis. Lactational osteoporosis is generally occurring in the lactating animals, those animals which are delivering young ones. After the delivery, after the parturition, they are very means in negative calcium balance, because they have to produce more amount of milk, and through the milk they will lose so much amount of calcium, and because of that they have development of this important disease that is called as a lactational osteoporosis. It says that in dairy cow up to 30% of the skeletal calcium is lost in the early lactation. So they are replacing, as they will replace in the next means lactation, when they will become pregnant, they have to feed much amount of calcium to replace this loss, but in during lactation period they will have the severe loss of the calcium, and that causes the lactational osteoporosis. Next disease called as a cage layer fatigue. This occurs in a hen which have a low calcium diet, and due to this they will have the very thin celled egg, and that type of egg is very prone to get fractured. That egg will not sustain. Once the egg will be delivered, that egg will be destroyed. So that type of disease occurring when the hen is getting low amount of calcium, that is called as a cage layer fatigue. So that is the gland that we have discussed, the thyroid gland and the parathyroid gland. Then we have seen what is the means how the calcium has been maintained, and what are the role of means what are the disease that is produced due to the abnormality of the calcium. Now we'll discuss what is called as adrenal gland. So adrenal gland means lie at the superior poles of the two kidney, and each gland has a two distinct layer. One is called as adrenal cortex and another called as adrenal medulla, and this cortex and medulla produce different kind of hormone. So we'll discuss one by one what is the hormone which is secreted from the adrenal cortex, and what are the hormone which is secreted from the adrenal medulla. So first we'll discuss about the adrenal cortex. If we'll talk about the means origin of this adrenal cortex originated from the embryonic mesoderm. It is not originated from embryonic ectoderm. It is originating from the embryonic mesoderms. These cortex are again divided into three zones, which each zone secreting different hormones. So the outermost zone is called as a zona glomerulosa. The outermost zone of this renal cortex is called as zona glomerulosa, and that secretes an important hormone that is called as a mineralocorticoid, or it is also called as aldosterone, and that help in regulating the electrolyte balance in the animals. So aldosterone or mineralocorticoid help in regulating the electrolyte balance in the body. Then middle zone is called as a zona fasciculata. Middle one is called as a zona fasciculata, and this produce important hormone that is called as a glucocorticoid or the cortisol. So this glucocorticoid or cortisol is produced by zona fasciculata, and this glucocorticoid help in the maintenance of the glucose metabolism, and also this glucocorticoid is responsible for the stress responses. Then innermost zone or third zone is called as a zona reticularis, and it produces some glucocorticoid, but it is unique in that it produces the androgens. So this zona reticularis is the innermost zone that mostly produce the androgens. So these are the three important zones in the adrenal cortex. So we'll discuss in brief about some of the hormones, important hormones of the adrenal cortex, and one is the called as a mineralocorticoid, also called as a aldosterone. So this mineralocorticoid helps regulation of metabolism of the sodium, potassium, and the chloride ions. So, and this mineralocorticoid or aldosterone have very important role in the RAS mechanism, that RAS, that RAA is called as renin angiotensin aldosterone system, that help in maintaining the blood pressure. So that have very important role because it help in the reduction of the sodium and the potassium. Synthesis and secretion of aldosterone is primarily regulated by the hormones that is called as a angiotensin, and also by the extracellular concentration of the potassium. So this extracellular concentration of potassium as well as the angiotensin help in the synthesis and secretion of this aldosterone hormone. The next hormone is called as a glucocorticoid, which means secreted from the middle zone, and this hormone have very important role in the carbohydrate, protein, and fat metabolism. And this cortisol secretion is regulated by the ACTH produced by the corticotropes or of the adenohypophysis, because ACTH, adenocorticotropic hormone, secreted from the pituitary gland, it help in regulation of the secretion of this cortisol or the glucocorticoid. So what are the effect of cortisol is there on the carbohydrate metabolism? That cortisol will stimulate the gluconeogenesis. Gluconeogenesis means the formation of means glucose from the non-carbohydrate source. So it have a very important role in the gluconeogenesis. Then also it will decrease the glucose utilization by the cells. It have the same kind of function as we have seen for the growth hormone also. Growth hormone also decrease the glucose utilization by the cells. So this glucocorticoid have important role in the stimulation of gluconeogenesis, and also it have a important role in decreasing the utilization of glucose by the cells. So in relation to that, another important term is there that is called as adrenal diabetes. Why adrenal diabetes is developing? Because I told that this glucocorticoid help in the increased rate of gluconeogenesis, and another function I told that this glucocorticoid will reduce the glucose utilization by the cells. So because of these important reason, one is gluconeogenesis, another is that it will reduce the glucose utilization by the cells. So if cells will not utilize the proper amount of glucose, that glucose will come into the blood circulation, and because of that the glucose will appear in the blood, and that is give the diabetic like symptoms, and that's why name has been given the adrenal diabetes. Because of this reason, this is occurring due to the glucocorticoid, that's why name has been given the adrenal diabetes. Now what is the effect of cortisol on the protein metabolism? The cortisol causes the reduction of the protein stores and essentially all body cells except those of the liver. So it will reduce the protein store. So mainly it will help in the catabolism of the protein. So it will decrease the protein synthesis and it will increase the catabolism of the protein which is already present in the cells. So the glucocorticoid help in a reduction in the protein synthesis. Then what are the effects of cortisol on the fat metabolism? It will promote the mobilization of fat from the adipose tissue. So its function is very similar to that of the growth hormone. Growth hormone also help in the mobilization of fat from the adipose tissue, and for this reason this will increase the concentration of free fatty acid in the plasma. So glucocorticoid have important role in the mobilization of fat from the adipose tissue, and also it will increase the concentration of free fatty acid in the plasma. Then what is the role of glucocorticoid on the stress, inflammation and the immunity? So cortisol is called as a stress hormone. So whenever the experiment has been done, it has been found that if the stress has been given to animal at that time, the important hormone secretion is there, that is the cortisol. So this cortisol will also have very important function, that it will block the early stage of inflammatory process. So it will block the early stage of inflammatory process. Also cortisol will stabilize the lysosomal membrane and prevent the proteolytic enzyme leaking from these cells. So in this way it will prevent the damaging of cells from leaking of the proteolytic enzyme. It will reduce the secretion of the histamines from the mast cell, so means it will prevent any kind of allergic reaction. Also it will decrease the phagocytosis and it will suppress the antibody formation. So in this way it will suppress, it have an important role in suppressing the immune system. So that cortisol have very important role in suppressing the immune system. So in this way they have a very important role in the stress, inflammation as well as in the immunity. Now what will happen due to the abnormal secretion of the glucocorticoid? So due to abnormal secretion of glucocorticoid, two important diseases there. One is called as a Addison's disease. That Addison's disease occurs due to the hyposecretion of the adrenal cortical hormone. So Addison's disease occurs when there is a adrenal gland fail to produce enough amount of hormone, and in this case the animal will be, there will be little or no cortisol in the blood. So that developed due to the hyposecretion of the cortisol hormone. This causes often autoimmune disorders where the body's own immune system will attack the adrenal cortex and reduce the hormone productions. So it is an autoimmune type of disease, Addison's disease, where the body's own immune system will attack the adrenal cortex and reduce the production of the hormone. The symptoms include the vomiting and the diarrhea, to the lethargy and the tremors, and this hypoglycemia is often present due to the lack of the glucocorticoid. Since glucocorticoid help in the gluconeogenesis, if the production is not there, that's why the hypoglycemia like condition is developing. Another disease that occurring due to hyper secretion of the cortisol is called as a Cushing syndrome. So Cushing syndrome occurs due to the hyper secretion of the cortisol hormone, and here the important symptoms is that it will give the pot-bellied like appearance in the affected animals, because this will causes this catabolism of the protein, and also very important features is that the face will look like a moon face. So whatever the fat is there, that is in the lower and the upper part of the body, that will mobilize and concentrate in the thoracic region. So the face will look like a moon. So that's why the two important symptom here for the Cushing syndrome is that one is they have a pot-bellied appearance, and second is that they have a moon face like appearance. So that is the symptoms of the Cushing syndrome. So affected animal often have elevated blood glucose concentration because this causes the gluconeogenesis. Animal exhibits the polydipsia and the polyuria. They have the more thirst and the more urine formation. There will be thin skin, hyperpigmentation, and the skin infections are very common in this condition. And also they have an immunosuppressive effect on the animals because of the high secretion of the cortisol hormone. Then last one is called as adrenal medulla. Adrenal cortical hormone we have seen. Now we will see what are the hormones which secreted from the adrenal medulla. So adrenal medulla, if we talk about the origin, it is ectodermal in origin, and the hormone which is secreted from the adrenal medulla is the epinephrine and the norepinephrine, and these hormones are synthesized from the amino acid that is called as a tyrosine. So for amino acid tyrosine, this epinephrine and norepinephrine are getting secreted. So the secretion of this adrenal medulla hormone is a part of the reactions of the sympathetic nervous system to the stress. And what kind of stress may be there that lead to the secretion of this epinephrine and norepinephrine? The stress may be the pain or any kind of physical injury or any kind of psychological fear. So this, what they will do, this circulating epinephrine and norepinephrine bind to the adrenergic receptor on the target tissue, and this stimulation of this receptor will causes the smooth muscle contractions, and also the arterial and visceral organ will contract. So what will happen, those muscles which are not actively engaged in the process, their blood supply will be reduced, and those muscles are actively engaged, their blood supply will increase, especially the blood supply to the muscles will increase, and those visceral organs the blood supply will be less due to this binding. So what will happen, that's why this epinephrine and norepinephrine is called as a flight or fight hormone. Why it is called fight or flight hormone? Because epinephrine and norepinephrine will give the blood flow to that particular organ which are actively engaged, like it will increase the heart rate, and it will also increase the force of contraction of each heartbeat, and then in the liver it will cause the breakdown of the glycogen and the muscles, that will cause the rapid glucose availability. So during the strenuous exercise or during any kind of stress or fear, the utilization of glucose is more, so in that case the availability of glucose will be provided by this hormone, and also it will stimulate the lipolysis of adipose tissue, so increase the basal metabolic rate. So because of all these factors, this hormone is called as a epinephrine, and norepinephrine called as a flight and fright hormone. So in this way, today we have discussed about the what are the abnormal secretion of the thyroid hormone is there. Then we have seen the how the calcium regulation is taking place, and then we have seen the adrenal gland hormone, adrenal cortical hormone, and the adrenal medullary hormone. So that is the end of today's lecture. Thank you.